Hi, we'll start out here talking about exactly what is trauma. Trauma is a pervasive condition. It can result from an exposure to an incident or series of events that are um, life threatening or emotionally disturbing to the person that it affects. It leaves long lasting effects on the person's functioning as well as their mental, physical, social, emotional, and or spiritual well-being. And trauma, of course, can happen to anyone at any time, though it has a um, a, a particularly debilitating effect on the brains of children. One very prominent type of trauma is called ACEs or adverse childhood um, experiences. These are traumatic events that would occur during childhood or before the age of 18. Risk for ACEs is elevated within certain populations, such as people who are Black, Hispanic, or multiracial. Certain people with less than a high school education, people with low income, or those who were unemployed or not able to work. The uh, ACEs are actually very prominent. There are um, um, 62% of adults actually have reported to have had at least one ACE, and 25% of the adult population has reported having more than three or more ACEs. One very There are several things that that can be done to stop and prevent ACEs, such as strengthening economic support for families through family-friendly work policies, um, 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 promoting certain uh, social norms that protect against violence and adversity in certain communities, um, using childcare to ensure a strong start for children children and families, teaching skills like social and emotional learning and safe dating practices, um, uh, um, pl- uh, placing youth in contact with caring adults and activities such as um, um, mentoring relationships and certain after school programs for kids, uh, and also intervening early to lessen the certain um, harm or in both the short and long term, or or such as with more primary care and victim centered services. For people um, who have gone through four or more ACEs during childhood, or has or will likely experience the following effects, such as being 2 times more likely to smoke, being 2.5 times more likely to have a a or a disease or infection, being sexually spread, being 4 times more likely to have COPD, which will affect your breathing and your lungs. They were um, 7 times more likely to be or to consider themselves to be alcoholics. They were 10 times more likely to have injected street drugs, and 12 times more likely to have tried or attempted to commit suicide. For people, there are two different ways for people to experience trauma, either directly or indirectly. And for direct causes, or the traumatic event, uh, such as childhood abuse, um, neglect, um, poverty, separation from a loved one, or violence, or such as from a war or terrorism, uh, or those events will happen to you directly for the direct cause, and then the indirect causes are any of those previous examples, but uh, they don't happen to you, but they can happen to somebody else, and you could witness them occurring, and even that or can leave a lasting effect on or on that person, even though it doesn't happen to them like directly. There are and certain causes of trauma. They can happen either from one-time events, uh, such as an accident, an injury, or a violent attack. There can also be ongoing stress, such as living or in a high crime area, um, battling a long lasting and life threatening illness, and then or I'm experiencing certain events that occur repeatedly, such as domestic violence, or bullying, or childhood neglect. And then there are also some things that we might not like immediately think of, or that might cause trauma, such as surgery, a the sudden death of or of a family member, the ending or of a long term romantic or um, like a romantic a relationship or an experience or that is very humiliating or disappointing can also cause or can cause the traumatic feelings.
Now we're going to dive a little bit deeper into what exactly is trauma-informed care. Trauma-informed care understands and considers the pervasive nature of trauma and promotes environments of healing and recovery rather than practices and services that may inadvertently re-traumatize. Re-traumatization is any situation or environment that resembles an individual's trauma, literally or symbolically. This would most likely then trigger difficult feelings and reactions associated with the individual's original trauma. The potential of re-traumatization exists in all systems, including the individual level, staff care level, or a system or an organization. And this may include violating the individual's trust in some way or choosing insensitive words when you're speaking with the individual. But trauma-informed care provides support services in a way that is accessible and appropriate to those who have experienced trauma. It doesn't necessarily treat symptoms or issues related to physical, sexual, or emotional abuse, but rather provides support services. Trauma-informed care seeks to realize the widespread impact of trauma and understand paths for recovery. It recognizes the signs and symptoms of trauma in patients, families, or staff members. It integrates knowledge about trauma into policies, procedures, and practices, and it actively, again, avoids re-traumatization. The core principles of trauma-informed care include safety, choice, collaboration, trustworthiness, and empowerment. Safety is defined as ensuring both physical and emotional safety. This can be practiced by respecting the individual's privacy. Choice is the individual has choice and control. They are provided a clear and appropriate message about their rights and responsibilities as a patient. Collaboration is making decisions with the individual and sharing the power. So the individuals are provided a significant role in planning and evaluating their own services. Trustworthiness includes task clarification, consistency, and interpersonal boundaries. There has to be some professional boundaries when working with the client, and this needs to be maintained as well. Empowerment is prioritizing empowerment and skill building. So this would be providing an atmosphere that the individual feels validated and confirmed in. A trauma-informed approach considers and modifies policies and procedures and treatment strategies from the top down in order to ensure that they are not likely to mirror the common characteristics of traumatic experiences. The key components to trauma-informed care include incorporating the approach to every aspect of the organization so that it remains consistent, demonstrating greater awareness of the impact of trauma on all individuals served by the organization. There needs to be an acceptance that trauma influences the effectiveness of all human services. And there also needs to be a solution-based service approach. So we're searching for a solution rather than focusing on the problem. Additionally, recognizing the pervasiveness of trauma is a key component of trauma-informed care. There must be a shift in language, so rather than saying, "What's wrong with you?" we should switch to, "What happened to you?" We need to anticipate and avoid processes that would re-traumatize the individual. And finally, staff at all levels should change their behaviors, actions, and policies to keep up with the trauma-informed care approach.